Under Sir Andrew Cabrera, CN 5502, Prevention and Management Exercise. Lesson 22. The head, face, eyes, ears, nose, and throat. At the end of the lesson, the students should be able to explain how injuries to the head, face, eyes, ears, nose, and throat can be prevented. Discuss the recognition, management, and process in dealing with injuries to the head, face, concussions, and mild head injuries. A. Preventing injuries to the head, face, eyes, ears, nose, and throat. The rest of injuries is these areas exist in all sports. However, the use of appropriate protective equipment and the discipline of the athlete that the head is not a weapon can visibly make a change on reducing the rest of the injury. Coaches have responsibility to make certain that athletes are taught and are using correct and safe technique.
How injuries in the nose can be prevented. Nose injuries often occur during play sports, accidents, fights, and falls. Pain, swelling, and bruising are common even with minor injuries. Home treatment can usually help relieve your symptoms. It may be hard to tell if your nose is broken. Swelling can make your nose look crooked even if it is not broken. When the swelling goes down after a few days, it is easier to tell if your nose is really crooked. Most doctors prefer to check an injured nose soon after swelling has gone down. Treatment of a simple fracture when the bone is still in place usually includes pain medicine and nasal decongestants. You may or may not need a nasal splint. Most swelling goes down after 2 or 3 days, but may take as long as 7 to 14 days. After the nose is set, nasal packaging may be inserted and a splint may be applied.
How injuries in the throat can be prevented. Throat injury can damage trachea and can cause difficulty in breathing, swallowing, or hoarseness of the throat. If the vocal cord are damaged, speaking will be difficult and there can be a hoarse throat or a complete lack of ability to speak if the vocal cords are more than just bruised. If swallowing is painful, have liquids and soft foods until it gets better. And also exercise is good for the body. And with the proper precautions, sports injuries can often be prevented. The quality of protective equipment have helped to improve the safety in sports. In recognizing and managing injuries to the throat, you must first determine the cause of injuries or conditions, sign of it, and the proper care.
How injuries ears can be prevented. Not every ear injury is avoidable, but it can keep prevent some by encouraging kids to never stick anything in their ears, not even cotton swabs or their fingers. Regular bathing should be enough to keep earwax at normal levels. What are the ways to protect your ear from damage? Move away from surface of loud noises, such as loudspeakers. Try to take a break from the noise every 15 minutes. Give your hearing about 18 hours to recover after exposure to lots of loud noise. Consider wearing earplugs. You can buy reusable musicians earplugs that reduce the volume of music but don't muffle it. This is our topic. Thank you and God bless. Keep safe.